Hello students, it's Miss Wood again, and I'm here this time to talk to you about central line dressing change. And once again, we're going to use our checklist, the one that's provided for you on Moodle. This is about central line dressing change, and the dressing change around the central line will be changed using sterile technique, and that's our goal for this procedure. Okay, so the first thing we're going to do, of course, is check our doctor's orders. So we're going to check and make sure that we have Mr. Terry Miller, and we're going to change his central line. It says every Monday and Thursday or PRN. So since today is Friday, we're going to do it PRN. So it must be saturated, and we sometimes we have to change it even when it's not time to do it. And that's why we get a PRN order. Okay, so we're going to wash our hands because we're going to be gathering our supplies. So you wash your hands. So the things that we're going to need are a central line dressing change, and you should have one of these in your kit. Central line dressing change, okay. A pair of non-sterile gloves, so because we'll need non-sterile. A mask. You have a mask in your central line dressing change, but you'll need an extra mask maybe for your patient if he can't turn his head. And I always bring an extra pair of sterile gloves just in case something happens to my gloves. Okay. And so there you go. All the things that you should need should be in your tray.
Ms. Wood,
yes.
This is a sterile procedure?
Yes, this is a sterile procedure. So you will be needing to, we'll be watching you for your sterile gloving. Okay, so this is a sterile procedure. Okay, we're going to go to the patient's room. Okay, knock, knock, knock. Going to go into the patient's room. I'm going to wash my hands. I'm going to identify my patient. So we're going to use two patient identifiers. Pull the covers back and look at his armband, his Mr. Terry Miller, and his date of birth, and we're going to compare that to the MAR, and make sure that when we scan it, it comes up. That name comes up on our. They match on our scanner. Okay, and we're going to explain the procedure to Mr. Miller and tell him what we're going to be doing. We're going to raise the bed up to a good working height. Okay, we're going to actually put the side rail down. Put the side rail down. We're going to expose the site because we need to get to it and we need to be able to have plenty of room to work. So we're just going to tell Mr. Terry that we're going to pull his gown down a little bit, and then we'll put it back when we get finished. We're going to need our trash can. So we're going to pull our trash can from around over and put it where we can throw our trash away easily. So. Okay, we've explained the procedure to the patient. We've asked him if he has any drug allergies because our gloves are latex, and if he's allergic to latex, we need to make sure that we don't bring a latex gloves in the room with us. Table. Is that how this table works? Goes up like that. Going to pull our table up to a good working height so that we can get to it. Make sure that our patient is supine, and if you need to remove his pillow, just tell him, so I'm going to move your pillow for now, and if we'll put it back when we get done. Okay, you can actually pull the head of his bed up a little bit so that he's not so flat if he's uncomfortable or he's having trouble breathing. Okay, so a little bit. Then we're going to ask him if he can turn his head away from the side. We want him to turn his head away from the side. If he cannot turn his head away from the side and he has a cough, we don't want him to cough on the site when we expose it. We're going to put a mask on him and ask him to wear his mask for a few minutes while we get this procedure done. Okay? Okay. So now we're going to open our central line kit. So we want to make sure that we open it away from us and that we don't put our hands over the top of it so that we keep it very sterile. Okay? And we can actually reach in and get our mask out. Okay? So that's what we're going to do. So we're going to put our own mask on. And for this, for taking the central line dressing off, we're going to wear non-sterile gloves because we're going to, it's dirty, and we want to make sure that we take it off and throw it away. Okay. So now we're going to take this, actually take this dressing off. So we just have to remember that sometimes these central lines are not secured very well when they're just in there. and there's no sutures, and sometimes they're sutured in, but still we could pull them out very easily. So we have to be careful. So we're going to start at the bottom and gently take it off. Just get it to release. Slowly, slowly, slowly. Okay. So, slow. Oop. Before we actually pull the dressing off, we want to make sure that we stabilize it so that when we pull the dressing off, we don't pull the central line out. And we want to pull away from the central line because we don't want to go over the top of it. And then we're going to roll that dirty dressing up in our gloves and take them off. Okay. And those can go right in the trash. Okay. Medical trash. They don't have to have a red bag, so medical trash. Now we need to get our gloves. Reach in and get your gloves out. And I always bring an extra pair just in case I mess up my gloves. So we're going to open our package and put our sterile gloves on. See, I need a new pair. So I would get a new pair of gloves because I have a hole in this one. Should I get a new pair? So I'm going to get a new pair. So thank goodness I brought an extra pair with me.
Because Miss Wood, if the client's central line was open like that, I couldn't leave the room to go get another pair of gloves, could I?
No, you couldn't. You'd have to call somebody and ask somebody else to come bring you a pair of gloves, and if they had time, they would at their time. So you want to make sure you have an extra pair. So now we're going to try that again. Thank goodness I didn't tear those, huh? So insert your hand in there. How was that? Now, I'm sterile, okay? So you have to remember that once you're sterile, you can't lower your hands below your waist. Elbows in, okay, and make sure that you keep your hands up. So now, in this box, I can fiddle with this box because I'm sterile. In this box is the cleaning solution that I'm going to need, the alcohol preps to take off any adhesive that might be left. So I can open these at this time. Drop it over there. So I have an alcohol prep. I have my dressing, and I have my Tegaderm that I'm going to use after I've cleaned the site. So the first thing I want to do is I want to pop my ChloraPrep. Okay, so that's what this is ChloraPrep. And I want to make sure that I don't turn my back on my sterile field over there. I'm going to dirty this hand now. This hand is going to be dirty because I'm going to hold this central line so that it doesn't go anywhere. Already popped it. So I'm going to start at the beginning of the, right around the open area, and I'm going to clean, clean, clean. And I'm going to try to use all the surfaces of my ChloraPrep all the way around. And then I'm going to come down and around, all the way around, and down and around in a big circle. And I'm going to make sure that I get all of the dried blood or any kind of escudate or anything that may be on that central line. And I'm going to throw that away. I'm going to reach in and get my alcohol prep. And I'm going to clean I'm not going to actually clean the site with this alcohol, but sometimes there's residue left after you take that adhesive off. And I want to make sure that's a medium for bacteria to get close to my central line. And I'll make sure that I get all that adhesive off. And then I'm going to allow my central line to dry for about a minute so that all that dries. And then I have my first little, this is called a fenestrated. It's got it's slit and got a hole.
Let me see see that slit, Miss Wood?
You see that slit? Fenestrated? Okay, it's going to go right around that central line. And I want to put it right there, okay? And then I have another little 2x2, and I'm going to put it over the top. Now, my central line is covered, okay? And so I can reach in and get my, now I can use this hand. I'm just going to help take the backing off, okay? So just a little piece so I can take off my sterile backing. And then I can put my dressing on. And I'm going to mash it in the middle to make sure that it's good and there's no air bubbles in there. And then I'm just going to work the way outward so that my central line is secure. And I'm going to gently peel this paper off, and as I do that, I'm going to make sure that I secure it down even better so that it's good and tight. And there's no air bubbles in there. We don't want any air bubbles. Then I can keep this because I'm going to put my initials, the date, and the time that I put that dressing on there. Okay. Then we can also take a piece of tape now, and we can chevron that down. And what I mean by chevron is that we just take a little piece and we tear it in half, and we just kind of pull your clamp up a little bit, and then just secure this tubing down a little better so that we're good. And a piece of tape over the top so that's good and secure. Okay? Now, so we're going to write our...
Just show us one time when you have something in your hand and you're sterile, how you going to drop it in the trash.
If I'm sterile, I'm going to drop it in the trash like that. I'm not going to put my hand down and into the trash. Just sterile, just drop it into the trash, okay? If it falls on the floor, and you can pick it up when you get finished. But you always want to make sure that you keep your elbow close into your waist and that you just drop it. Okay? All right? Got it? So now we're going to clean up our mess. I'm going to take off my gloves. Okay, put them in the garbage. Put my patient's gown back up. And of course you can take his mask off, throw it away, put his pillow back, make him comfortable. Okay, put his sod rail up, his bed back down, cover him up because he was covered up when I came in. Take my own mask off, okay, and discard all those things. So now we're going to thank the patient, make sure he's comfortable. The bed is in low and lock position, side rails are up ×2, and his call bell is within reach, okay? And then we're going to document. So the things that we're going to document are the time and the date of the dressing change, okay? So make sure you do that. Appearance of the central line, so what did it look like? Was it red and swollen? If it was red and swollen and it's oozing anything coming out of it, you know, it's purulent drainage, then that needs to be reported to the doctor as soon as you can, get it covered back up, and then immediately tell the doctor, because that means that it's infected, and so we'll have to do something different to that. So make sure that it has that it's, you know, what it looks like. So the exudate that comes out of it, any redness or dried on material that might be there. Okay, color, odor. So remember too that odor, if it has an odor, it could be caused from infection as well. So you want to make sure that when you take that dressing off, if you smell something, you need to chart that. Okay, be sure that you chart that. Amount of drainage, the care that was provided. If you had to do anything else for him besides just changing the central line dressing, you want to document that too. If he told you that it hurt or whatever, so you want to make sure that you do that, and then how the patient tolerated it. Okay, so thank you very much.